Hi, good morning. My name is Nyangi and I'll be your nurse today. I'm gonna close the door and wash my hands. Can you tell me your name and your date of birth, please? Okay, I can see over here. Okay, yeah, it matches with your waistband. So today I want to do the your muscular assessment, which includes your muscles and your joint. Is that okay with you? So from the start, I'm gonna ask you some question. Do you have any muscle issues, or you have joint pains, or you have muscle pains? No. Have you ever had arthritis, or have you ever had arthritis before? No. Does your family have history of joint pain? Any muscle pain in your family? No. Oh, okay, that's nice then. So I'm gonna start by checking on your. I'm gonna do your assessment from the head to toe. So I'll just do. I'll inspect. I'll do inspection. I'll do palpation. I'll do range of motion, and I'll check your strength of your muscles. I'm gonna start on the upper part of your body. So can you open? I'm gonna start by inspecting your TMJ, your jaws by bilateral. So I'm gonna inspect for any lesions or any swelling. I don't see any swelling over here. So I'm gonna palpate for any swollen parts that I can feel it. And I'm gonna palpate to see if there's any clicking or crepitation. So can you open your mouth for me like this, and can you close one more time? Can you stick your chin out, sting in, cheek out, in, side to side like this? Okay. Do you feel any pain on your jaws? No pain? Okay, that's good. Okay, so my patient's jaws are symmetric bilateral. When I'm gonna move down to your neck, I'm gonna inspect for any lesions or moles. I don't see any lesions or moles around your neck. The skin color around your neck is the same. I don't see any discoloration on the color, which is good. Then I'm gonna palpate any swelling around your neck. Okay, so it looks good. Now I'm gonna do range of motion of your neck. So I'm just gonna tell you what to do, and you're gonna follow what I'm doing. So can you move? Can you turn to your right like this? Turn to your left. Can you turn your head up, down like this, up, down like this? Do you have any pain while you're doing it? You are turning your head up and down, side to side? Oh no, you don't have any pain. Now I'm gonna check your strength of muscle strength around on your neck. So can you move to the right move your neck to the right side against my resistance, to the left side against my resistance? So the muscle strength of your neck are equal bilateral. So now I'm gonna gonna come down and inspect around your shoulders, your shoulders. So I'm gonna inspect for any lesions, any moles, any like fracture. I don't see any fractures. So do you have any pain around your shoulders? Do you have ever had a broken shoulder or something like that? No, you've never had broken shoulder. Okay, now I'm gonna palpate your shoulders for any swelling. Do you have pain while I'm palpating your shoulders? No? Okay, now I'm gonna do range of motion around your shoulders. Now I want you to follow what I'm doing so that I can see what I'm doing. So can you raise your hand up like this? Your hands down like this, and I want you to raise your hands up again and touch back of your head like this, and up again, down, and touch at the back like this. Okay, up, down, up at the back of your head, down at the back at your back. Okay, do you have any pain while you're doing range of motion? No, don't have any pain. That's good. Now I'm gonna go and do the strength of your shoulders. So can you raise your hands up against my resistance? Down, up, down. Okay, do you have any pain while you're doing the range of motion? And when I was checking the strength of your muscles around your shoulders, any pain? No pain? That's good. So the strength of my patient's shoulder are equally bilateral. Now I'm gonna move down to your elbows. I'm gonna inspect your elbows for any lesions. The skin is nice and smooth, and I don't see any discoloration of your color around your elbows. I don't see any. Gonna palpate for any swollen parts. I don't see any swelling. Sometimes people have swollen elbows, but I don't see any swollen elbows. Now I'm gonna do range of motion around your elbows. Now I'm gonna ask you to follow what I'm doing. I'm gonna do it first, then you're gonna do what you're gonna follow back what I did. So for your elbows, I want you to stretch your elbows up, then bend your elbows, straight your elbows up. Okay, then I'm gonna do against my resistance. Move your elbows against my resistance. Okay, now gonna stretch your elbows, gonna bend it, then I'm gonna do against my resistance. This side too, gonna do against my resistance. Do you have any pain while you're bending your elbows and you're stretching your elbows? No pain? Up, down, up, down. Do you have any pain? No pain. So the strength of the elbows are equally and bilateral. One more thing. Now we're done with elbows. Now I'm gonna inspect your hands and your wrists at the same time. So for your hands, I'm asking you to do like this, your wrist down, your wrist up. Then I'm gonna do against my resistance. Then I'm gonna inspect your fingers, each bone of your fingers, on the joint of your fingers. Do you have any pain? Yeah, that's what I'm gonna do. I'm gonna inspect your fingers. Do you have any pain while I'm doing this? No pain. Wrist up, wrist down, wrist against my resistance, wrist against my resistance. Do you have any pain while I'm doing that? I'm gonna assist. So the strength and the muscle strength of your wrist and your hands are equally bilateral, and I'm gonna come to do the final test and internal test, whereby on these two tests I'll be checking carpal tunnels, if you have a carpal tunnels or not. It's a carpal tunnel test. So for the first one, I'm gonna ask you to do like this, and I'm gonna inspect. If you feel any pain while I'm doing this, let me know. Do you have any pain? No. So another thing, I'm gonna ask you to do your hands like this for a while. Do you feel any pain? No. So your carpal tunnel test is good. Okay, now I'm gonna move to your hips. I'm gonna inspect, palpate range of motion and your strength. I'm gonna start by inspecting your hips. Your hips. Okay, your hips. I don't. Have you ever had a hip fracture before? No, you have never had a hip fracture. That's good. So I'm gonna palpate for any broken bone or something. Like, do you feel any pain while I'm palpating your hip? No pain. So, and I don't feel any swelling or like abnormal stuff on your hip area. So now I'm gonna do range of motion around your hip. Now I would like you to stand up, stand straight, and I'm gonna instruct you what to do. When you stand straight, I'm asking you to turn while your hip stays still on the stand. Don't move your hips, just move your upper body without moving your hip. Move to the left, move to the left, to the right, left, to the right, left, left, right, left, right. So do you feel any pain while you are moving your hip? No pain? Okay, that's good. Now we're gonna move to your knee, to your knees. Oh no, I'm gonna skip your knees first. I'm gonna do your lower. Yeah, let's do your knee first. So while I'm doing your knees, like, I'm gonna ask you to stretch your leg, move up, bend it to the side, up, bend it to the side. Go straight against my resistance. Move outward your leg against my resistance, inward against my resistance, outward against my resistance, inward against my resistance. Do you feel any pain? So your hip strength is equally bilateral. For your knees, I'm gonna ask you to sit up, and I'm asking to bend your leg against my resistance. Against my resistance, against my resistance. And I'm gonna inspect your knee. Do you have any pain while I'm palpating your knee? When I'm palpating your knee, inspecting for any lesions. Inspecting for any lesions. Do you have any pain while I'm doing this? I'm palpating for any swollen knees, or for any edema. I don't feel any swelling and no edema, which is good. So your knee strength and range of motion are equally bilateral. Now I'm gonna go check your ankle. I'm gonna palpate, inspect first. Your ankle looks good. Your ankle looks good. I'm gonna palpate for any swollen part or edema or something like that. I don't feel any edema. Now I'm gonna do range of motion of your ankle and your foot. Go push your foot against my resistance. Push your foot against my resistance. your ankle. Can you move, bend your ankle in, out, in, out? So your ankle, oh, can you push your ankle in against my resistance, out against my resistance, in against my resistance, out against my resistance? Call your ankle and your foot strength and muscle strength are equally bilateral. Now we're gonna move to your spine. Your spine, I'm gonna inspect your spine for any lesion, for any abdominal feature on your spine. I don't see any abdominal feature on your spine. I'm gonna palpate. I'm gonna ask you to bend, and I would like to see the C7. Yes, it's right here, the C7 now, and I can see the C curvature of your spine, which is good. That's normal. If you see the curvature of the C curvature of your spine, which is good, and I'm gonna ask you to follow what I'm gonna do. I'm gonna ask you to bend forward like this, then up and back, up, forward, up. Okay. While you're standing, I'm gonna ask you to bend forward, up, back, up, forward, up. So when so did you feel any pain when you're bending forward and back? Didn't feel any pain. So your spine range of motion is intact. So on my assessment, I didn't your range of motions of joint and muscle strength are intact, and I didn't see any abnormalities when I was inspecting your muscles and inspecting your joints and your muscles. Do you have any question for me before I leave? No question for me? Okay, keep doing some exercise to make your muscles strong, and that's it. Thank you for being my patient.